Hello and welcome to Fit After 40. I'm Chris here with Tony. Our guest today is Tracy Hannigan. Tracy is a sleep therapist, and we're very excited to talk to her about sleep quality, insomnia, and so forth. Tracy, how are you? Welcome to the show.
I'm doing great. I've been looking forward to having this conversation with you guys for a while.
I have as well. I have
Mhm.
as well.
Same.
So let's talk a little bit about you before we begin. What made you want to get into sleep therapy?
Both personal and professional interests. Back in the day, way back in the day when I was living in California, I did a degree in psychology and worked in community mental health. So a lot of interactions between mental health issues and sleep, both directions. Fast forward many years, moved to the UK, and I trained as an osteopath. And obviously, working in pain clinic settings, you see the connection as well between sleep and pain and vice versa.
Mhm.
Having gone through all of that, I also had two bouts of insomnia myself. So I was
Mm.
personally interested in something that's very academically interesting, which is sleep. So I decided to become qualified and I trained in cognitive behavioral therapy for insomnia, acceptance and commitment therapy, and a couple of other add ons, all evidence based approaches to the treatment of insomnia, and have been working doing that ever since.
Starting at the beginning, what makes high quality sleep and why is it more than just kind of being in bed for 8 hours in a row?
Right. There are a lot of different angles to that question potentially. Um, if I asked a room full of people, would you rather have 8 hours of choppy sleep or 6.5 hours of good quality solid sleep? Most people would pick 6.5 hours of good quality solid sleep. And that's
Hmm.
because they feel better, both
Mhm.
physically and emotionally, less frustration than if they had choppy sleep for 8 hours. And the more often we go in and out of sleep, the harder it is to know if we've slept because the brain's not very good at knowing if we're awake or asleep. Anybody who's had a really potent nightmare and has woken up from it, still carrying the emotion, can kind of understand that. The things that improve people's sleep quality tend to be the things that are the opposite of what is recommended when people are having sleeping trouble. So we can reduce our sleep quality and give ourselves insomnia, for example, by spending a lot of excess time in bed or
Hmm.
by being physically inactive. And a concerned friend might say to someone, you're not sleeping very well, why don't you take a nap or why don't you have a lie in? Or maybe don't go to the gym because it's extra hard to go when you're not
Hmm.
sleeping well. That actually will
Mhm.
make sleep worse over time. What we want to do to improve sleep quality is to get sunshine, particularly first thing in the morning and in the middle of the day. So I always say food, light, and movement first thing, because
Hmm.
particularly sunshine morning and afternoon improves people's sleep quality. Only go to bed when you are actually really sleepy enough to sleep and have a consistent wake up time. Those
Hmm.
things help keep sleep consolidated, which will help it be as deep and refreshing as it needs to be for any given person. You got to take your eyes off the clock and the numbers of hours
Yes.
and go more by how you feel. And I know it's very tempting to track everything.
Yeah.
uh, Particularly, yes, absolutely.
Yeah.
I wear, devices and their watches and their nearables. They aren't always accurate,
Hmm.
particularly in the things that tend to be the most interesting about the data in air quotes that it provides.
Right.
Yeah.
Um, just very fascinating, very tempting, but not very helpful, particularly if you're not sleeping well.
Hmm.
So really quick before we move on to that, because beyond that, because we all are kind of obsessed with these devices, right? Like my wife doesn't even like things on her wrist, but she still obsessively wears a watch just because she wants to see what the sleep tracking number is on Garmin. And I do the same thing, obviously. Like every morning, I'm like, oh,
Me
how well did
too.
I sleep last? Like I need to know how
Mhm.
I slept last night. Obviously, I'm sure there's a physiological way to assess how I slept last night better than looking at my watch, but that's what I do. So, what are your thoughts on these watches and the types of information they provide?
So the technology is getting better, but they are all still using proxies for how sleep is measured professionally. So they are using respiratory rate, heart rate variability, accelerometers to feel movement. but they are still not up to scratch. If you take the readings off of a watch and you compare to somebody who's been put in a sleep lab, you take that person in the sleep lab with a watch on, you're going to get a different picture. They are slightly more accurate with, in certain models, slightly more accurate with like how long someone has slept and when they have when they have fallen asleep. Not so good at the wake up bits and when they've started for the day. So you can kind of get a general idea of what that block looks like. But people get very obsessed, particularly with the sleep staging with these devices.
Yes.
Very tempting to, if you're trying to optimize our health or fix a problem, we want all of the details. And that's where they're not good. Unfortunately, they're not good, but even if they were good, most people don't know how to use the information that they would be providing. I've had people come to me very concerned that they don't get 100% deep sleep according to their device or their watch.
Like a coma.
And yeah, exactly. I mean, it would be really, really unhealthy, a real bad sign if somebody was getting 100% deep sleep, because the typical human in the middle of their life, would be getting maybe half the night in light sleep or a little bit more than that in light sleep. And that would be considered normal. If you're older, say you're 75 and you were put in a sleep lab, it wouldn't be considered abnormal for that person to have no stage 3 or deep sleep. And we also experience a decrease in REM sleep over time. So there are a lot of different factors that lead to watches being a problem, the inaccuracy, the tendency to over monitor for people who are anxious about their sleep, and the fact that it's not helpful. Even if you aren't sleeping well, that data isn't used by a sleep therapist to help somebody with their sleep.
So before we go any further, I think it's a good time to define the stages of sleep. So for the listener that may not be aware, of course we've mentioned all three of them, but do you mind just telling us a little more about each stage and what role they play?
Yeah, they keep chopping the stages up.
Yeah, right.
But, the more questions we answer, the more questions we have. But in general, we're looking at light sleep in stage 1 and 2, which would be considered non-REM sleep. We have stage 3 sleep, which would be more what we call slow wave sleep, which is also kind of non-REM sleep. And then we have REM sleep. So REM sleep, a lot of people get the deep sleep and the REM sleep confused. They're saying, I'm not getting enough deep REM. Well, deep is one. Stage 3 is the lowest. If you're looking at one of those graphs, it would be the lowest point in the graph. And then REM sleep is one of the highest. So there's very little difference, actually, aside from what's actually happening in the brain, between stage 1 sleep and REM sleep. So both are quite light. And again, we spend the majority of our time in stage 1 and 2, a bit of time in stage 3 and a bit of time in stage 4. And then we have a brief awakening and then we cycle right back through. REM sleep is where they believe, again, lots of questions still about this, where we tend to do memory consolidation. Slow wave sleep, deeper sleep tends to be where they believe most of our cleansing and repairing is going on. Internally, when our brain and our bodies tends to be when our immune system is most active. Stage 1 and 2 kind of blur together a little bit. There are different types of brain waves that happen there. Stage 1 is almost indistinguishable in some people from just a really deep state of relaxation. But it allows us some physical rest. So a lot happens in sleep. It looks very passive from the outside.
Right.
It's actually very, very busy from the inside. We burn a lot of glucose at night just from the activity going on in our brains.
So what it sounds like is that if you take a nap in the middle of the day, you're really only going to do stage 1 sleep. You're not going to get the psychological benefits from REM or the physiological benefits from deep sleep. It's some rest maybe, but it's not the restorative sleep that we think of when we think of getting a good night's sleep.
I think it depends on how long the nap is and how sleep deprived the person is. So if a person is sleeping well at night, they're probably going to have, and they have a short nap, they're probably just going to get a little bit of attention. They're going to ease off a little bit of sleepiness and have a little bit of rejuvenation. But unless they sleep for a longer period of time, a person who's sleeping well at night won't go through a cycle and have all of those. In people who are sleep deprived for whatever reason, maybe they're working 3 jobs and they've got 8 kids and they're just not getting the sleep that they need. The brain knows what it needs. So even if you have a short sleep, if your brain decides right now I really need to make up some REM, that person could fall asleep relatively quickly and spend a lot of time in REM and then wake up, and the person probably feel pretty rubbish when they wake up, not
Yeah.
more refreshed. And if the brain decides actually I really need some slow wave sleep in this block, it will take what it needs. We tend to try to outsmart it by thinking that it should go through all of these cycles all of the time, but the reality is it adapts just like our
Hmm.
body adapts with depending on what's going on with it. And we have to stop and learn to trust it because it will take care of itself. Whether it's comfortable for us or not, it tries to take care of itself.
Hmm.
Hmm.
And I think we've all taken a nap that lasted too long, and maybe our
Oh,
brain did try to do that. And I've been there where I just couldn't I
just
couldn't get
can't
it
wake
together for
up.
the rest of the day. Yeah.
Yeah.
Mhm.
Let's talk about factors that disrupt sleep. Maybe we could start with kind of the things that a lot of us go through in middle age, the hormonal changes. How does that impact
Yeah,
sleep?
yeah. Hormonal changes for females and males have an impact on sleep. When we all experience relative deficits and increases in these different hormones as we go along. For example, take one that is uncommonly talked about for women, was very commonly talked about for the gents. That's testosterone, right? Testosterone tends to decline over age. That is connected to an increased predisposition to being a little bit more anxious. And
Hmm.
for females, we have a small amount of testosterone, but it falls off a cliff like it's nothing,
Mm.
increases our predisposition to being anxious. For women, the change, even cyclically throughout life, the change in progesterone throughout the menstrual cycle can have an impact on sleep because progesterone interacts with melatonin, which is another really important hormone for helping kind of keep the brain a little bit relaxed, right? So
Hmm.
that one's important. Estrogen for women, hot flushes, because of the variability, can be sleep disruptors. Those things can disrupt sleep on an ongoing basis, but that doesn't necessarily mean that that person is suffering from insomnia.
Hmm.
Insomnia is a psychobiological. So that's one big category that tends to hit that time of life for everybody. There's big changes. Sometimes there's job changes. Sometimes there's retirement. Kids are leaving the house or going to whatever. There's lots of things going on. If we have a response to those kinds of things that we kind of rationalize, okay, I'm not sleeping well because of X, Y, and Z. But if we start to become worried about the sleeplessness itself, we get stuck in a
Hmm.
cycle because our brain does not want us to be sleeping if there's danger around.
Right.
And if we perceive we are in danger because we're not sleeping well, we get stuck in a little bit of a loop. So that's a common one around this time of life. Another two really common sleep disruptors are sleep apnea, particularly obstructive sleep apnea, and restless leg syndrome. So both of those show up on the scene a little bit more, particularly the obstructive sleep apnea. Again, that's not insomnia, but they can have a significant impact on somebody's sleep and their quality of life.
What is that? What is sleep apnea and how is that treated?
Sleep apnea, there's an obstructive type and there is a central type from the brain, and then there's people can have both, so there's a mixed type as well. Sleep apnea is essentially the problem where we go into deep sleep,
Hmm.
and when we're in deep sleep our muscles relax. This is so that we stay kind of paralyzed in that time, so
Right.
when we go into REM sleep we're not kind of acting things out. So we go into deep sleep, transition to REM sleep, we are paralyzed, our tissues become really slack, and that includes tissues of our throat. And so if our airway narrows, even if it doesn't close, if our airway narrows, that can make it challenging for the brain to get the oxygen that it needs. And so it sends a signal to wake up, come up into lighter sleep. Our muscles tense, it clears the airway. We take a big, deep breath, and then we go back to sleep. And for some people, this can happen
Hmm.
many, many, many times in an hour, and they
Mm.
don't necessarily even remember it. That person will feel extremely sleepy during the day, whereas
Hmm.
a person with insomnia will kind of feel tired and wired. So the sleep apnea obstructive type is a result of the mechanics of the body creating a problem for sleep. For breathing while sleeping, sleep disordered breathing, a central type is more in the brain. The signal is not being sent correctly.
Hmm.
And so the body wakes up to make sure that it can keep breathing, which is quite
Right.
important. Yeah. And then there's mixed, and people can have both.
And then, could you talk a little bit about the treatments for it? I think a lot of
Mm.
us have seen the fighter
The
CPAP.
pilot
Darth Vader
mask that
mask.
some people.
Yeah.
You're right. Yeah, exactly.
Yeah.
Yeah.
Yeah,
So.
so treatment for when there are lots of sound bites out there about how unhealthy bad sleep is, et cetera, that
Mhm.
tends to, it doesn't land the message to the people who need to hear it, but it terrifies all the people with insomnia who are scrolling on their phone in the middle of the night. Um, that message really needs to be taken on board with people who have sleep apnea, because that is the sleep disorder for which there is excess health risk attached to it. When
Hmm.
it's treated, that risk goes away. And a lot of people don't want to get diagnosed and they don't want to get treated because they have this image of the Darth Vader mask on
Right.
Yeah.
their face. Those treatments for obstructive sleep apnea or for airway resistance disorders, which are a little bit different, basically help maintain the airway patency, keep it open so that the
Hmm.
breathing can continue, so that the brain doesn't wake the body up in order to be able to breathe. There are lots and lots of different ways. There are, not necessarily got the Darth Vader mask. There are much smaller masks available.
Hmm.
There are oral devices that are available. There are positional devices for the jaw that are available. There are lots of different options. So I would encourage anybody who has sleep apnea, who's worried about the Darth Vader mask,
Hmm.
to keep their mind open and to explore other avenues, particularly if sleep apnea is milder. There's less of a
Uh-huh.
chance that you're going to have to use a mask at all. They're all much smaller than they used to be. And there's often a fear of treatment because a person would imagine, how could I sleep with something on my face?
Right.
Well, if you get prescribed something that you have to wear on your face, you get acclimatized to it during the day. Usually, there is a person who helps guide you and teaches you how to use it. You wear it during the day, you get used to it being on your face. And so that way, when you use it in the night, it's not like something suddenly is
Right.
parked on your face. I wouldn't be able to sleep well just
No.
flipping a switch and doing that either.
No. I
Yeah.
always wonder also about sleep labs. How well can people sleep with
When in a sleep
all
lab.
that?
Yeah.
Yeah.
Yeah,
So.
it cuts both ways. That's a really interesting one. Some people who are pathologically sleepy because they have sleep apnea usually sleep well in a sleep lab because they're pathologically sleepy during the day and at night. A person with insomnia, it depends. If they have a really terrible sleep environment at home and they have a lot of anxiety attached to their bed, sometimes they sleep better someplace else.
Huh.
Mm.
Yeah, so it's a and same thing on holiday. People with insomnia become worried if they're going to sleep on holiday, and is their holiday going to get ruined because they're not sleeping well. Sometimes removing themselves from that environment where there's this
Mm.
disrupted association between sleep and the bed, and sleep, it's easier to sleep someplace else, ironically.
Hmm.
Yeah.
Huh. Interesting. Yeah. I would always think like just the observational effect of
Yeah.
it and everything like might have like a psychological effect.
It
Uh,
might, yeah. What's interesting is that people in sleep labs, when they're asked how much they sleep, they often will sleep more than they say they did. And that's because we are not very good, like I was saying, at
Yeah.
being able to detect whether we are awake or we are asleep.
You remember waking up. You
asleep.
don't necessarily remember all the hours that you were actually asleep.
Exactly, exactly. We are a biased observer.
Let's talk about behavioral factors and stress. How
Yeah.
these impact sleep. So let's start with stress. So how do these stress hormones, things like cortisol, how does this impact sleep? I mean, negatively, I think we can assume, but maybe you could
Yes. Yeah.
unpack it a little more for us.
Yeah, stressful experiences will all disrupt all of our sleep, and whatever is stressful to one person might not necessarily be stressful to another. But there are pretty common stressors that will impact sleep, like bereavements, moving
Mm,
house, big things, right? Um, that when we have a lot of this kind of stress hormone in our body, cortisol being one of them, we also have to say to ourselves, gee, what else does cortisol do? Cortisol, it has a really useful function when we're stressful. It makes it easier for us to access our energy, but it's also part of the waking up process.
Right.
So it will naturally get in the way of people being able to sleep well. And when we can add on that extra layer of stress then as well about the not sleeping itself, which raises our stress level and makes sleep even more problematic. So
Right.
there's a pretty direct physical impact on our ability to sleep. And just psychologically, or emotionally, if we are distressed by something, it just
Mhm.
makes sense. Our brain has a lot of ability to be resilient. The way we think has a huge impact on it. A lot of the work that I do with clients is about reframing the whole experience of not sleeping so that it is less stressful physically and emotionally.
And then what about behavioral factors? Maybe we could talk a little bit about sleep hygiene, what that
Yeah,
is, how that supports sleep,
right.
how staring at a screen maybe isn't optimal right before bed.
I have so many things to say. So, sleep hygiene tends to refer to those things that have an impact on our sleep from the outside. Having a dark room, having a
Mhm.
cool room, not eating a massive curry 3 minutes before you go to bed, those sorts of things. Those factors can have a little bit, they can add a little bit of help to somebody whose sleep is a little wobbly, but surprisingly, if you look at all of the recommendations, the worldwide recommendations from all of the major medical and sleep associations, sleep hygiene is not a standalone recommended intervention for insomnia. And that's because insomnia is driven from the inside. And so,
Hmm.
one of the tricks is if stepping back from that, if you look at sleep hygiene as a top up, if we're not doing the actual interventions behaviorally that affect insomnia itself, we're setting up a lot of people through a lot of the sleep messaging for having a really hard time because they're trying to sort their insomnia out, but they're using sleep hygiene to do it. And then they feel
Hmm.
like they failed, which makes them feel like they're broken, which makes the whole thing a lot worse. So
Mhm.
just want to bear in mind, if you're a good sleeper, these sleep hygiene things are fine. Darkness is actually not necessary. If people see the video of this recording, I'm standing in a bright room. I'm in the UK. I'm at a high latitude. It is light at 4:30 in the morning in the middle of the summer. We
Hmm.
never pull this blind and I sleep fine.
Yeah.
But for a lot of people who might be sensitive to light, having a blackout blind is a great idea in this country. There's a difference between somebody who puts up a blackout blind and somebody who tapes the blind to the window because they're terrified the light's going to come in.
Hmm.
That person is afraid, and it's the fear keeping them awake, not the little bits of light. So
Right.
sleep
Yeah.
hygiene can be taken too far by the wrong people, and the American Association for Sleep Medicine actually says we don't want sleep hygiene being recommended because it puts the emphasis in the wrong place.
Hmm.
Behaviors, that is where we lead into behavioral sleep medicine and ways people can actually help themselves with insomnia. But you brought up a really interesting point about like light and scrolling. And it's a myth that I like to bust. I think people worry too much about this, no screens for 3 hours before bed thing.
Hmm.
Um, in the past, they started this off by looking at so blue light, daylight, which has a
Yeah.
lot of blue tone to it, um, helps maintain our circadian rhythm. It's a great way to wake the circadian rhythm up by getting light first thing. If we stay in a dark room 24/7, or if we go blind or something like that, our circadian rhythm gets completely disrupted because it doesn't have that signal. It's a powerful signal. They did studies of people looking at laptops for 5 hours before they actually went in to go to sleep, and they measured their melatonin levels. And yes, that much exposure to bright light, laptops being much brighter than phones or tablets,
Yep.
which do not emit enough light even without night mode on to have an influence. They looked at those people, they said yes, their melatonin onset time was delayed by an hour and a half, but what they didn't do is they didn't actually study the impact on people's sleep.
Hmm.
Fast forward, and then they started to do both. Yes, there was an impact on melatonin onset, so it was delayed by that hour and a half, but it only had an impact on people's ability to fall asleep by about 3 or 4 minutes. So I
Okay.
think
Huh.
people get, people worry excessively about this, and then they shame themselves for having looked at their phone for 2 minutes before they went to bed. I just think that it's unnecessary. It's more important to do things that you like to do in the evening than it is to overly worry about some of these very specific things. Now, is it a good idea otherwise to get off the phone? Maybe. If following the news distresses you, don't follow the news
Right.
before you go to bed.
It's very
Everybody has button
stimulating.
issues. Yeah,
Right.
exactly. Be sensible. If you're sensitive to zombie movies, don't watch a zombie movie before you go to bed, or at all, in my case. Um, so those are behavioral things that we can adapt and adjust to based on our own knowledge of ourselves, right? But it's a great soundbite, and I think parents in particular really like the no
Yeah.
screen idea.
Right.
I'll go a little further. The people who are at risk of having issues with sleep because of devices tend to be people who are less worried about the impact of risk, like risk consequence. So think teenagers who don't really care what happens the next day if they don't sleep because they're going to class they hate anyway. Those
Yeah.
people are more, or people who get into flow and they get a lot of dopamine, and then they keep going, and then they keep going, and they keep going. That's not insomnia. That's more like sleep procrastination and then not getting
Right.
enough sleep. Yeah. So it
Right.
can have an impact on sleep, but not in the way that people think. Really interesting stuff. When it comes to other behaviors, naps are terrible if you're having bad sleep. Um,
Right.
Waking up some days at 6 and other days at 11 and other days at 7, other days at 2 p.m. That's not a good behavior to engage in. That's more likely to lead to problems with sleep as well.
Mhm. Now, I think that you've alluded to the difference between insomnia and people who just have poor quality sleep. Um,
Mhm.
but are there textbook definitions we can use to differentiate these two? What is insomnia?
Insomnia
Sure.
is a psychobiological condition that is characterized kind of clinically as somebody who has difficulty falling asleep, staying asleep, or waking up too early for the day. It's
Hmm.
characterized by that hyperarousal as opposed to sleepiness. And in theory, you have it, 4 more days of the week for 3 months or more. What I would
Okay.
say is if you are having that much difficulty with your sleep and you're not pathologically sleepy, it's better to intervene before you have 3 months of um, negative kind of cycling behaviors, like trying to stay in bed and taking naps and doing the things that are going to make it worse. And also the negative habit loops in the brain, which are, oh, I'm going to get into bed. I wonder if I'm going to sleep tonight. And now I'm stressed and therefore I don't sleep.
Hmm.
I'd rather have somebody not spend 3 months doing that before they have a chat with someone, because it's harder to break those habits than it is to avoid them in the first place.
So let's talk about your work. If someone comes in, and let's start with probably the more common and milder cases. Someone like me. I sleep okay most of the time, but probably a couple of nights a week, I am going to either struggle to fall asleep or I'm going to wake up and struggle to go back to sleep. 2, maybe 3 nights a week.
Mhm.
Where do you start with someone like me who has mild to moderate sleep issues?
So I would first, we always start when looking at sleep, we start in the morning. And
Hmm.
with someone who has intermittent issues, there are two potential avenues. One is to look at how a person's day is compartmentalized. Are they dragging their daytime into their nighttime? And where can we put things into place to kind of create a block that is dedicated, say, for work, a block
Hmm.
that is dedicated to family time, and then a block that is dedicated to you, ideally, winding down in the evening and doing something that you enjoy doing. It's about keeping that excess mental energy someplace else. So that would be one first place to start. Another place to start would be to look at sleep quality on the nights that are the quote unquote good nights. If that can use a little bit of optimizing, What I would say is potentially we could look at doing a little bit of sleep compression, which would initially be done by fixing a wake up time and then not going to bed until you're absolutely sleepy and not going to bed because of the clock. Because if your body's not ready to sleep and you get into bed because the clock says you have 8 hours until your alarm goes off, there's an expectation and a hope for sleep, which can get in the way because that can be arousal. And it sets you up for laying in bed being frustrated, which is also not a nice association to have with the bed. So you want to wait until you're actually really sleepy. And then from that point, we would look at and see what the diary looked like. There are techniques for compressing people's sleep to deepen the quality. But what we don't want to do is take away sleep that's already being gotten
Hmm.
the rest of the week. That's the difference between an intermittent issue and something that's a little bit more persistent across the weeks.
And if someone comes in with more serious sleep problems, what did you say it was? Four nights a week for 3 months?
Yeah, most of my clients will come in, they will be having issues every night of the week and sometimes for years. And so, in a
Mm.
situation like that, first we screen for other sleep disorders. I can't technically diagnose those disorders, but I can screen for them on the basis of excess sleepiness. As we were saying, big difference between insomnia and the other disorders is excessive sleepiness. They say they don't have excessive sleepiness. We look at a diary um, to look at how long is somebody sleeping, what does the pattern look like, and behaviors to tighten that up. Again, fixing a wake up time, we would start with how sleepy somebody is,
Hmm.
reassess how much total sleep they're getting, and then do some maybe more assertive adjustments. But at the
Okay.
same time, it's really important, I think, to do some of that mindset work, the work on the anxiety around the sleep itself.
What symptoms should someone be looking for in themselves? Like me, I wake up often in the night. Sometimes it takes me a few minutes to go back to sleep, but I don't necessarily feel tired the next day. So, is it a problem?
I don't think it's a problem in a scenario like that. If it's a
Hmm.
problem for the person, they will know it's a problem in the daytime
Hmm.
because they will be either hyper aroused, worried, and concerned about the not sleeping, or they will be sleepy.
Okay.
Some people are naturally short sleepers, so we can't necessarily go on the number of hours. In a
Hmm.
situation like that, I would ideally like to see that sleep happening in a block, but I would never say to somebody if you don't who doesn't feel they have a problem with their sleep, who tells me they wake up a couple of times and they fall back to sleep relatively quickly, I would not want them to then think that they have a problem because that creates problems, doesn't it? We all wake up
Right.
many times at night. We don't always remember it. It's normal to wake up a couple of times long enough to remember it and then to fall
Mhm.
back to sleep. It's only an issue if people are asleep for a long period. So we don't want to pathologize those normal wake ups and have somebody then
Mm.
start worrying that something's wrong with their sleep because that will create problems with their sleep.
So it sounds like anxiety is the real issue in a lot of these cases. People are over worried, they're over focused.
Yes, I don't think I have ever worked with anybody who did not have some kind of tendency to worry or be anxious, whether or not it's clinical level or not, or they may deny being anxious, they may deny being worried, but they are perfectionists in the rest of their life. I see perfectionism as a manifestation of anxiety and a need to control things to feel safe,
Mm.
kind of all underpins. But in terms of personality traits, perfectionism is a really big one. Those
Hmm.
two things, perfectionism and particularly anxiety, worry based types of situations, make somebody much more likely to start worrying about disrupted sleep and then get stuck in that cycle.
Hmm.
So I have kind of a side question here in some ways. If you're, say, somebody that like maybe sleeps well, but is easily awakened by sounds in the night versus somebody that when they're sleeping well. So we're talking about two people that are sleeping well, but one person is easily distracted by sounds in the night and can wake up like quickly, where versus like somebody that just is like can go through a tornado and not be
Hmm.
affected by that all. at all. Is one of these people getting higher quality sleep than the other?
That's a really good question. What I would love to know is if they've done studies where they have looked at the same sound impact on two people who have those characteristics to see what their
Yeah.
polysomnogram looked like. I am a light sleeper, but I consider myself a good sleeper. So I would be the person who would, we had to take the wind chimes down so they
Mhm.
keep me awake.
Yeah.
That sort of thing. Whereas my son would sleep through a tornado.
Mhm.
Yeah.
I think that different people are just wired a little bit more tightly than others. And so if we look at levels of consciousness, if we have coma at the bottom and then
Yeah.
unconsciousness and then sleep and then restful wakefulness and then restful alertness and then you kind of progress up to just like really wired, totally focused, really on it. If you have that spectrum, that affects sleep. So we have these experiences of lighter and deeper sleep. And I think that people who are just wound a little bit more tightly are just a little bit closer to
Yeah.
that threshold of being woken up.
Yeah. It's one of those things we think about. My wife and I are those two people that are wired those two different ways. Like she will sleep through a storm. I'm the one that, like, I know when one of our little dogs gets up and needs to go outside at 2 a.m, and I will hear that jingle and I'll get up and take the dog outside. So
Yes. Yeah. It's quite funny how light sleepers and heavy sleepers end up together, and how night owls and early birds end up together.
Yeah.
Really, really common. And snorers and people who can't stand snoring end up together.
Yeah,
that is unfortunate.
That is.
Yes, it is.
Tell me about alcohol. I know several people who have said, oh, I need a glass of wine or a cocktail to help me go to sleep at night. Otherwise, I don't sleep well. What do you say to someone like that?
I say beware of the slippery slope for a lot of reasons. So even a small amount of alcohol, it might help relax you, might take the edge off. I enjoy that too. But the flip side of it is that it's going to disrupt your sleep. Alcohol essentially takes slow wave sleep and chops it up into a million pieces or deletes it entirely. And people might have noticed this themselves, that you might have one drink with dinner and you don't really notice it doesn't super affect your sleep. But if you have two, you might wake up at 2 or 3 in the morning and you have this patchy in and out sleep. Maybe your heart starts going. It's generally really bad for sleep. And people who drink nightly, for whatever reason, whether it's sleep, whether it's dependency, whatever it is, even after they stop drinking, their sleep can still be disrupted for quite a long period of time. It's almost like the brain learns a new habit of sleeping that looks like the alcohol sleep. I don't know what the physical mechanism in the brain is that creates that, but it is a phenomenon that's pretty reasonably well known. Right. So with alcohol, earlier is better. Don't drink straight up until the time you go to bed. And ideally, stay within, healthy bounds, because the slippery slope is the dependency piece.
Sure.
Yeah.
And they keep dialing back those guidelines. It used to be, 3 drinks, now it's 2, and for women they're saying now 1. And really it kind of seems that there's that if you want to have a drink, but don't think that it's good for your health. Don't fool yourself on that one.
Yes, I think there's a couple of different angles on that. Some of it is we learn more every day about the impacts of our behaviors and how they affect us. And some of it is perhaps an increasing conservatism in health. It could be a lot of different reasons why. My philosophy is everything in moderation. And the same thing goes with caffeine. As a sleep therapist, I will sometimes do a session with somebody and I will have my coffee and I will confess that I'm having my coffee. Coffee can disrupt sleep for sure. Especially if you accidentally don't make yourself a decaf, but you make yourself a caffeinated coffee in the afternoon. I have done this, oops. And then I'm awake and I'm like, I must have accidentally swapped the capsules.
I wouldn't sleep if I had caffeine afternoon.
But even if you drink excessive amounts of caffeine early in the day, you're not beginning to build up a drive of sleepiness until that caffeine starts to wear off because there's so much of it. So that
Mm.
can make it difficult to fall asleep simply because you've delayed the buildup of sleep, what we call sleep drive and sleep pressure, because of
Mhm.
the caffeine in the system so early.
And how is that the caffeine functions? That's kind of an interesting thing the way it, because you talk about how you haven't built up that ability to sleep, and that is because of the way caffeine actually functions in your brain, right?
Yeah. So if we imagine that sleep drive, which is responsible for falling asleep and staying asleep, is like a balloon, and after a good night's sleep, you have an empty balloon because we've slept it all off. And then the longer you're awake, the more physically active you are, the more sleep drive you build up, and you need a really big balloon. In isolation, if you didn't have any anxiousness about sleep and your circadian rhythm was completely aligned and there were no stressors in your life, your balloon would get to a point where you go, "Oh yeah, I feel sleepy now." If
Mhm.
we if we take a nap, we let air out of the balloon. If we drink coffee, we let air out of the balloon. And the air in that balloon is, they believe it's adenosine, which is a chemical in the
Okay.
brain. Caffeine binds directly to adenosine and prevents its function in helping us build up sleepiness. That's why if you have
Mm.
a coffee, it can make you feel a bit more alert about 20
Yeah.
minutes afterwards. Same reason why if you're feeling excessively sleepy, you take a 20-minute nap, you can feel more alert after that. It's because you've taken a little bit of that sleep drive out of that balloon. And then typically what happens is you go to sleep and then air drains out of the balloon and then you start all over again. It's a completely
Hmm.
biological system, that one. But I do love my coffee. Sometimes people are
Me too.
surprised.
Yeah.
I probably drink more than I should, but I keep it to the morning so that
Uh,
hopefully, and I try to keep it to one
Mhm.
or two cups.
And we don't want to cut out things that we really love in our life. Life
No.
is really short.
Mhm.
Ideally, we want to be working on our sleep so that we can live a better life. We don't want to
Right.
ruin our life in order to have 8 hours of unconsciousness. It just seems backwards to me.
It does
Yeah.
become
yeah.
self-defeating in that
That's
regard.
true. Yeah.
So let's talk about sleep for athletes, people who are training for something. How does intense training impact sleep?
It can have a variable effect depending on intensity.
Hmm.
So, one of the things that fills up that sleep drive balloon is physical activity. So, a person who is moderately active is going to build up more sleep drive than somebody who is completely sedentary. When we are doing really intensive physical activity, particularly if we don't let ourselves recover, because I'm looking more to like the non-functional overreach, overtraining ends
Mm.
of things, it really can mess up your sleep because your system is in a state of constant kind of sympathetic drive, constantly being physically stressed because of the lack of recovery. That makes sleep really challenging. That creates really light, really broken sleep. Whereas if you are training intensively, you're allowing for enough rest, i.e., you're aiming for more like functional overreach and
Hmm.
supercompensation for development. That can be good for sleep as long as it's managed really well. They tend to recommend that people avoid heavy training in the hours right before bed. So
Hmm.
saving those, personal record breaking experiences for the
Right.
morning
Yeah.
because they produce stress on the body. Now, the
Right.
stress is intended to help with adaptation, right? That's why our body goes into that mode. It's like, well, I've got some repair to do, and I've got some stuff going on, and I've got to
Right.
release a lot of glucose, and I've got the cortisol now coursing through my body, and adrenaline, and I feel amazing, and the dopamine's there. We don't want that there for sleeping, so
Right.
saving that
Yeah.
for earlier is better, so that things can kind of stabilize before we go to sleep.
And how does heart rate variability impact sleep and recovery?
Well, in an ideal situation, we would all have really high heart rate variabilities. And now I'm
Hmm.
not a pro with heart rate
Yeah.
variabilities. My understanding of the way that it functions is if you have high heart rate variability, you have an ability to adapt rapidly to the demands of either activity or sudden cessation of activity. Like I'm thinking interval training, you
Hmm.
can adapt more quickly than if you have a low heart rate variability. It's associated with less cardiac risk and less health issues overall. Now, with with sleep, if we high sympathetic drive activity,
Hmm.
high stress, and this is actually the same in the daytime, but we tend to measure heart rate variability baselines at night.
Right.
We have a lower heart rate variability. The stress impacts our ability to kind of have that adaptation. So the heart rate variability measurement drops.
Yep.
Um,
Which means
that's
this heart
another.
rate remains elevated.
The heart rate can
Often
remain
so.
elevated,
Right.
but the its ability to adapt to
Hmm.
change has changed
Okay.
essentially.
Okay.
Yeah. Um, we measure, I think most people measure heart rate variability overnight. And the
Hmm.
reason why it's done overnight is because we're not getting emails from our boss and our
Right.
kids aren't harassing
Yeah.
us. And, we're not digesting a massive, there are fewer things interfering
Right.
with the measurement. And so it's not reflective necessarily of how it's going to be during the daytime, or in an individual kind of situation. It's least confused of all potential heart rate variability markers.
Hmm.
And you can really see things like, when I look at mine, or look at my partner's, depending on what's been going on, if he has had overtraining syndrome in the past, boy, what a dive. He can
Hmm.
see himself getting sick in his heart rate variability before he starts
Yes.
to see it, because he now knows what the pattern looks like.
Hmm.
um, Mine was very poor, when we were originally having our first conversation about this amazing show. And it turned out, wow, I really felt unwell. It tanked like 22. I'm like, oof, I should be in the
Yeah.
ground at that rate. you know, but my body was under a lot of stress. And so stress affects the body, that
Right.
affects our ability to adapt, whether it's heart rate variability adaptation or our ability to lay down muscle repair as fast as
Mm.
we possibly could. And that's why getting good rest reduces stress on our body and on our brain, which
Yeah.
then allows our body to recover. So, in terms of recovery and athleticism, that's why the sleep piece is really important.
Hmm. Absolutely.
I feel it in myself. If I'm doing lots of lifting and I don't sleep well, it takes me longer to stop feeling so much pain
Hmm.
in my new
Recovery
workouts. Yeah,
slows.
absolutely.
Yeah.
The
Yeah.
DOMS takes a little longer to dissipate.
When I was training for I ran a marathon a couple of weeks ago, and when I was training for that after my long runs, if I did my long run or an intense run too late in the day, it really hit me hard. So
Same.
I
I
feel
used to
that.
be in a kayaking club. Same thing. And the only training night that we had on the Thames, which is a very scary place to be in a kayak, was at night. I just had to accept that if I was going to do that, I wasn't going to fall asleep until 3 o'clock, because but I did, I
Right.
wanted to do it. So that was just informed consent.
There you
Short
go.
sleep that night.
It's just before we get more into kind of the psychological approaches, we should at least mention sleep medications, what they do, what their limitations are. Can we start with the common classes of sleep medications?
Yeah, a lot of people self-medicate
Hmm.
first of all, so they will use over-the-counter things that have medications in them that create a
Sure.
bit of sedation. So I'm thinking about
Yeah.
the antihistamine
Right.
category.
Benadryl.
Um, yeah, allergy medicines and those sorts of things. They can create sedation. So
Mhm.
physically sedate you, obviously mentally sedate you. So those are easy to access for most people. And then when you go to like prescription level, lots of different classes. And now different classes of medication that used to only be given for certain things are now given for lots of other things. So there's a big blur. If you said, list all of the sleeping medications out there, a lot of
Yeah.
things are prescribed for sleep that are not necessarily for sleep. And trazodone is an antidepressant that is very
Yeah.
sedative, is tends to not be hugely addictive, although people struggle to come off it. But that's used because it's considered safer than, say, a group of medicines like benzodiazepines,
Hmm.
Yeah.
Xanax, Valium, those sorts of things. They're very habituating. They're very
Hmm.
addictive, and they create lots of problems for people when they come off. Um, So you have antihistamines, you have benzodiazepines, you have mainly these class of kind of antidepressants or anti-anxiety medications that are a bit sedating. There are new medications coming out all the time that function a little differently and are given for sleep, such as don't know if the drug names are the same
Might
in
be
the
different.
States. They tend to vary, but Zopiclone, Ambien, that
Yeah.
category also can be habituating, but not so much as the benzos. And then they function as sedatives. I think a really important couple of things to think about with medication is that when they are used for sleep specific medications, they're not intended for long-term use.
Right.
So I really strongly feel, and a lot of my sleep physician friends strongly feel, that when someone has a prescription for sleeping medication, that first conversation has to include, what's the plan for coming off that medication?
Right.
Because I have seen people who have been on things for 20 years. And then all of a sudden, because the laws change or the access changes or the rules change, they can't get it anymore.
And they can't sleep.
And yes, well, I mean, they have physical withdrawal.
Ooh.
They have rebound insomnia, and they have the panic because they've associated sleep with the pill that they've been taking for 20 years.
Right.
It just really doesn't set people up well for success to prescribe like that. But prescriptions are easier to give than one-to-one or even group sleep therapy, simply because of the volume of people who need support. Unfortunately, there are not enough of us to be able to help everybody.
Right.
And GP appointments tend to be short, and that's what they know. It's unfortunate because it doesn't help people in the long run. It's a temporary band-aid, and I'm not totally against it.
That's what I was going to say. Is there
medication use? Yeah. People come to me on meds, but they should be used with caution, I think.
Yeah.
So what would you say is the use for them? Like what is a healthy use of these sleep medications? And like, say, with people you deal with, like, where's the situation that you would say is a good use versus like this habitual use?
I think the perfect scenario for using a sleeping medication such as Ambien, again, I'm not a prescriber, but this is just my view on it, is, I've had surgery on my shoulder, and I'm really uncomfortable, and it's really getting in the way of my sleep. And it's an acute situation that's going to resolve itself. I think that's what those things are ideal for, really. Yeah. With other situations, like somebody who might come to me, had people come to me with lots and lots of different scenarios, as you might imagine. I think that when people's anxiety is completely out of hand, that kind of goes beyond my scope of practice. And sometimes suggesting that they go see their GP for something to help with their anxiety will help with the sleep a little bit. But my goal in that situation is to help reduce the anxiety to where I can help them manage it with my skill set so that we can focus on the sleep. And so sometimes that is an appropriate use. Me, not the doctor here.
Right. What about jet lag? How do you deal with jet lag?
I think it depends on how much jet lag and what direction. So when I go from the UK to the States, when I'm going to the East Coast, I don't pay much attention. I just kind of grind through it. Coming back, however, because I like to make the most of my time, and coming this way is harder. And that's really interesting. If we put ourselves in a box and had no impact, no light affecting us, our clock rhythm would advance. It would go in the direction of me flying to the US, which that's why it's easier to adjust going that way. Coming back, we're going against the grain in all directions. So I will start waking up earlier before I leave so that I'm closer to being on time when I get back. Now, if it's a lot longer than that, it's simply going to take a lot longer to get over it. You can expect a day or so for the average person to recover and sort out about an hour's worth of jet lag. Certain times medication could be appropriate in scenarios like that, melatonin, but melatonin is often used as a sleeping pill when it is not a sleeping pill. It's used to adjust somebody's circadian phase. And so if you're going a certain distance for a certain number of hours to help drag the circadian rhythm back to where it's most appropriately placed for a person, you might wake up in the morning, and then 2 hours after you wake up, you take a small amount of melatonin. And that's simply to send a signal to that part of the brain to change where it's going to start triggering. It's not to put the person to sleep. That's why people get confused with that advice. Because they're like,
Right.
wow, I don't want to sleep at 10 o'clock in the morning. Well, no, you're taking
Yeah.
a tiny dose just to send a little boost to that part of the brain about what time things should happen. And it just helps drag the rhythm to the right place.
Can you talk a little bit about the overuse maybe of melatonin? That seems, at least here
It's
in the
very
United States,
common.
that's a very common thing. People, they take it every night.
Every night.
Eaten like candy.
Yeah.
Yeah. So a lot of Americans are really surprised to learn that, for example, in the UK, it's prescription only. Because you
Oh,
can go to any store in
It's
the US and
yeah.
you can buy your bottle of
yeah.
melatonin. I really, really struggle with the everything is fixed by a pill issue.
Yeah.
I would much rather see somebody sort out the underlying issues. Taken in high doses, melatonin can be very sedative, but it also interacts with a lot of other hormones in the body. And so I just don't think it's a great idea to necessarily take it all the time. There's some evidence that in women 55 and over, a small dose of melatonin can be supportive of sleep quality because of the perimenopause and menopause experience.
Mm-hmm.
The problem that melatonin in the States and in most places who it's available over the counter is that you don't know what you're getting. There have been a couple of really big studies in the US and in Canada where they have taken, I don't know, a number of brands and tested what's actually in them. And some of them, they might say they've got 5 milligrams. And just for
Right.
reference, sleep physicians start out by prescribing 0.5 milligram to 1 milligram. Our dim light melatonin onset is like it's like 0.3 picograms or something. It's really tiny amount. It's really
Gotcha.
small. So 0.5 milligram is big for the brain, but people are going to the big box shops
5.
and buying 15 milligram pills, right? They're horse pills.
Yeah.
Right.
But you look at these and it says a milligram, but maybe it actually has 10 milligrams in it. And maybe the next pill in that bottle doesn't have any. And they've even found serotonin in some of these bottles of over-the-counter melatonin, which is dangerous to take, especially if you're taking other psychiatric medications, because you can have something called serotonin syndrome, which creates seizures, etc. So it's really risky because you don't know what you're taking. You could be taking a lot of your main ingredient, you could be taking none, you could be taking something completely random. So my advice to people who do have access to melatonin over the counter is that you steer clear of the super cheap brands and you get something that is tested by a third-party independent tester. So at least it's not appropriate to take it for insomnia, but at least if you're taking it, you know what's in the bottle.
Yeah. Third party testing is so critical with unregulated markets like the supplement market.
Absolutely. I mean, especially if you're talking about high level athletic competition, you don't want to
Right.
risk your ability to participate because you bought something cheap at a big box shop, right?
Right.
That would be tragic. Yeah.
So do you use meditation in your practice?
I don't. I tend to focus on the behavioral elements. What I
Okay.
say about meditation, formal meditation is not something I'm very well versed in, but I
Okay.
do appreciate a mindfulness practice that is easy for people to incorporate. And so I might
Okay.
incorporate some simple mindfulness meditation types of activities,
Sure.
daily mindfulness experiences we can all create just to make it easy for people to be able to bring it into their life. What I would say about people who want to meditate to improve their sleep is that they meditate during the day,
Okay.
create some compartmentalization, become skilled at meditating during the day, and then if they enjoy it, they can then meditate in the evening. Because what we don't want to do is introduce a new thing that is a skill and have it happen right before bed where somebody is trying to make themselves fall
Right.
asleep using that, because It's a skill, and you have to become good at it to have an effect. You need to practice, essentially.
Right.
You need to have experience with it in order to get the most out of it. And you can get a lot out of it by doing it during the day, just to kind of keep your life a little bit kind of more even keel and happier. But if we're doing anything close to bedtime with this real strong pressure to make sleep happen, it's going to backfire because there's too much pressure on it.
Yeah.
So, what does a mindfulness-based wind down routine look like?
So pick something you enjoy that is not that is very present and in the moment, and it's not based in the past, and it's not based on the future. So you could be watching television, could be a mindfulness activity. You're in the groove, you're in the flow, you're just there, you're in the story. I like to knit because I like the physical element of that as a mindfulness activity. When I'm thinking about mindfulness, I'm thinking about just creating an environment where you are right in the present moment, and different things will do that for different people. It's that experience of flow, but not flow as in you're just going to keep doing it all night. So there's a difference between watching a movie that comes to an end and binging Netflix, which never stops if you really like the show, which I can be guilty of, right?
I think we've all done it before.
Procrastination. But I think the take-home message is that we don't want to be overly prescriptive and have a rigid routine of things that we must do before bed. I encourage people to look at basically have dinner, clean up after dinner, the entire rest of the evening be about nurturing yourself and doing the things that you like to do, which keep you in that present moment. Because the drama that happens at nighttime for people who struggle to sleep is usually what happened earlier in the day, what happened 10 years ago, what's going to happen tomorrow, what's going to happen tonight. It's not, right now I feel the fabric on my pajamas and I love my sheets, and wow, this $3,000 bed feels amazing. It's nobody who is in the moment like that is stressing out about whether or not they're going to sleep.
Sounds like good advice for a general quality of life, not just sleep, doesn't it?
It really is. And one of the reasons I like these basic daily activity mindfulness kinds of approaches is that everybody can do them. They don't require a lot of practice and skill. We can wash our hair in the shower and just be washing our hair in the shower and not thinking about the meeting and thinking about the calendar and thinking about the kids and those things will come back in because they're things that we have to deal with. But taking a few minutes to just drop all of that is fantastic for our stress levels. If we're talking about athleticism, recovery, and sleep, it's perfect.
Right.
And I really appreciate this whole idea that the screens like you shared earlier and now, and watching television doesn't necessarily have a negative effect. We go through that. Every night I watch one episode of television a day pretty much, and it's right before I go to bed, and I have to do it to some degree just to go to sleep. Like that is like that release. And I didn't know the mechanics behind why that is, but you're just kind of, you get it absorbed by one thing for a little bit, and then it's easy to go to sleep afterwards. So.
Yeah, I know for myself when I'm out of my usual context. Example would be my partner's at kickboxing. My default activity as an entrepreneur is to open up the laptop, and there's like an endless amount of stuff to do, right?
Sure.
That's
always.
not great for sleep. Or I am really into genetic genealogy. That really, really excites me, working on the tree. And that's not a great thing for me to work on if I want good quality sleep either. But there are other things when I'm more in my normal rhythm in my context, when the kids come home and then there's the dinner and then that routine and then the cleanup and then we kind of all chill out together and then I knit, and that sets me up and I go sit outside because it's quite light out when I go to bed. Sit outside and I watch the birds and the squirrels do their final commute to wherever they're living. That's a really good setup for a nice night of sleep.
Yeah.
That sounds nice. Well, Tracy, this has been fantastic. This has been really interesting. I think hopefully there's a lot of really good takeaways for folks. If our listeners wanted to connect with you, where could they find you?
They can find me at tracythesleepcoach.co.uk, pretty much on all of the socials. I'm more or less active on different ones at different times. My website is tracythesleepcoach.co.uk. And people who might be interested in having a chat to see if I can help, they can book a free 20-minute chat with me just by clicking the button in the header.
That's excellent. We will include all those links in the show notes. And if there's anything else you want to include, just let us know and we'll send that out. Thank you for your time. This has been fantastic. We really appreciate it.
Thank you so much. It's been great being here.
Thank you for listening. Please make sure to like or subscribe on Apple, Spotify, or wherever you get your podcasts. We also list the show notes and have lots of bonus content available on Substack or Instagram.